for me, I think NHS England can really lead the way globally with the introduction of ISO 7101, and I'd really like to see this as part of the standard contract for all healthcare organisations in England. So NHS England issues a contract to everybody for the delivery of services, and of course there are other international standards included with that contract, and I think it'd be great to see this from a quality perspective being absolutely prominent. Now, it's going to take a bit of time, and organisations are going to have to work hard to get to the level of accreditation, but I think that's a really important starting point. And also, we were talking about regulation, and I think the CQC, the Care Quality Commission, recognising this standard as a quality standard and utilising that as part of their inspection regimes could be extremely powerful to the improvement of healthcare in Britain and in England, more specifically through the powers that NHS England have and the Care Quality Commission. So I'd love to see it as part of that compliance. To be an NHS organisation, that you have to have accreditation or be working towards accreditation for ISO 7101, because that is what's going to deliver better healthcare to the public and to the people that we're here for.
We present The Standard Show, the podcast that brings you the stories behind the standards, with Matthew Childs and Cindy Paragill. Today's episode is on ISO 7101, Healthcare Organization Management.
Hello, this is Matthew Childs, and welcome to The Standard Show, the podcast that brings you the stories behind the standards. Now, the voice you heard at the top of the episode was that of Professor Adam Layland, healthcare practitioner, leader, academic, and standards maker, talking about the subject of this episode, and that is ISO 7101, the first international consensus standard for healthcare quality management. He was responding to my question about the use of ISO 7101 in the NHS in England. Now, it goes without saying that healthcare organisations everywhere are under increasing pressure to deliver more with less. And for many years, healthcare has been facing three sustained threats: increasing demand from ageing populations, decreasing funding in comparison to this demand, and an international workforce shortage. This so-called triple threat is only anticipated to become more problematic. And of course, since 2020, healthcare organisations around the world have faced a fourth threat, and that is COVID-19. This resulted in changes to ways of working which required a balance between finances and quality. So it's in the context of these threats that led the international standards community, working with the healthcare sector, to develop ISO 7101. The standard sets out requirements for a quality management system designed to help healthcare organisations take bold steps to improve the quality of healthcare around the world. So this episode is my conversation with Adam Layland about ISO 7101, what it's all about, who's been involved, the benefits of it being used, and the difference it will make.
This is Cindy Paragill with a reminder that here on The Standard Show, we really welcome your feedback. Please rate and review us wherever you get your podcasts, especially if you listen to us on Apple Podcasts or Spotify. Find and follow us on X at Standard Show and on Instagram at The Standard Show. And check out the show notes for all of the ways to get in touch.
So, Adam Layland is a director and clinician in the NHS in England. He was the international convener of the ISO working group, which developed ISO 7101, and is the chair of the BSI Committee on Healthcare Organisation Management. In this first part of our conversation, he describes what ISO 7101 is all about, why it's been developed, and who's been involved. And of course, being the Standard Show, he also describes his standards journey. I started by asking Adam, how and when did that start for him?
So I've been racking my brains on the very first moment that this started for me, and I can't remember the exact moment. And you might know, Matthew, because we obviously met at the very start of my standards journey. But the bit that really stands out to me is, whilst I was at Coventry University, we hosted the Occupational Health and Safety Standards International plenary. And we effectively took over the ground floor of one of our buildings in the university and welcomed people from all around the world to develop the International Standard on Occupational Health and Safety for a week. And it was absolutely fantastic. And I met so many amazing people from standards development, national standard bodies, and of course, British Standards Institute. And talking to one of the committee managers throughout that week was what really sparked my interest in the importance of standards and how standards fulfill my aim of being able to help people on a day-to-day basis and have that wider impact overall. And it was at that point that I was asked to help with a committee that had been a little bit dormant, and had had a great start, but had just fell a little bit by the wayside for various reasons, all very genuine and understandable reasons. And I was asked to lead this committee and to support its growth and development. And that was the Healthcare Management Committee for the British Standards Institute, which I've done for the last 4 years now. And I'm really pleased to be handing the reins over on that now to a new chair, whilst I remain an active member of the committee. And just in the short time that I've supported standards development, not only have we grown the committee tenfold, our membership has dramatically increased, and we've got a lot of active members. We've developed 2 standards. Now, that doesn't sound like a lot in 4 years, but for those that know standard development and how much time and effort it takes to develop these standards, I'm really pleased that we've got 2 standards now published. The first one being our validation framework for the use of artificial intelligence in healthcare, which one of my colleagues led on absolutely amazingly well, and has been a leading force for the development of AI in healthcare, and our international standard for healthcare quality management, which has been published very recently as well. And so that's what got me into standards, and what's kept me in standards is probably a really pertinent point of, the networks, the people, and the value that standards add onto the day-to-day lives of everybody that you don't even know about. So everything that we use on a day-to-day basis, particularly in Britain, has probably got a standard somewhere associated with it, but it's not something you think about. But without it, the quality and the experience that we have will be not anything like what we've got right now. And that for me is where values adds a lot to our day-to-day lives, and people give a lot of time to develop standards, which is wonderful. It's all voluntary in that development, and I'm really lucky to have had some amazing people in the committee that have not only supported our 2 standards that we've led, but have been supporting the development of tens and twenties of other standards, both across Britain, but also with the International Organisation for Standardisation as well. And I'm really, really proud of that journey, and really proud to be part of standards making. And I still feel like an imposter, though, Matthew. I do feel very fortunate to be part of the BSI and part of ISO, and some days I have to pinch myself and go, "Well, what? How on earth did you get there? What are you doing?
Well, I do.
And do you know? Do you really know it?"
Well, I'm very proud also to have played a little part in your journey there. You talked about the plenary, and I do remember twisting your arm a little bit, saying, "Would Coventry University like to host this plenary?" And you did, and it was fantastically successful. And the committee manager you talked about there, Sally Swingewood, formerly a BSI,
Yes.
now with ISO, and doing fantastic things there. And it's been fantastic, Adam. It's been fantastic to see you become a standards maker, chairing committees, and now developing standards. And not an imposter at all. Absolutely fantastic work. And you mentioned, Adam, one of the standards you mentioned there, which I want to talk to you about today, healthcare management, ISO 7101. Can you tell me, Adam, in a nutshell, what is this new standard all about?
Yeah, so I'm really proud that this standard is now published after 4 years of hard work by some absolutely incredible people in every continent of this planet. And so ultimately, this standard is about really giving healthcare something it can hinge its quality management onto. We've just come through one of the most horrendous times our healthcare services will ever experience through COVID and the tragedy that the pandemic caused and the change that we've had to experience because of that. So I think this standard is landing at exactly the right time that healthcare organisations need it. But for many years, we've had multiple problems in healthcare, and often referred to as the triple threat. As such, we've had decreasing finances, the draw on public money, not only in the UK but around the world, for everybody in healthcare systems that are publicly funded or independently funded. Finances is a major issue. We have got a growing population. The population in every country of the world, and more so in eastern parts of the world, the population is growing faster than anywhere else, which is great for people and great for families, but has a massive strain on healthcare resources and the ability for healthcare to react to people in the way that they need it to have a quality of life overall. And we know that's just increasing. So, particularly in England, the Health Foundation recently published a report of the projections of illness in England up to 2040. And we're going to not only see an even older population, but we're going to see people living much longer with multiple comorbidities or multiple morbidities. That is going to have an impact on health services to make sure they live the best life that they can. But of course, that will be for a longer period, which is great. Medicine and what we do in medicine has really helped improve life expectancy. It's really helped to improve the quality of life for people. But there's more people that need it, and there's which leads me on to the third biggest threat of this triple threat is, where do we get the staff to do this from? We haven't got enough people working in healthcare to deal with the growing population that we've got, and of course the demands that brings onto a health service in the right way, of course, because it's all there to help people. And so, because of that, I think the World Health Organization for 2030 is estimating a 20 million workforce shortage of healthcare staff. That's huge. 20 million people we need in healthcare just to live up to the demands that we're facing for 2030, let alone what's going to happen in 2040 and the huge population increases that we've got. And so this really creates a huge problem for healthcare organisations on how do you balance the money, your workforce, and your quality. One of them's got to give, surely. It can't be a perfect recipe, and we see all around the world where everybody is struggling with this triple threat, and of course exacerbated by what we've had with COVID-19 and all of the tragedy and the hard work that's gone alongside that. So, ISO 7101 has really been a movement. It's not just been the development of a standard, it's been a movement to improve quality of populations and the quality that healthcare can have around the world. And we chose a management system standard to be able to do that, because that kind of gives the parameters and the principles and the openness for people to be adaptive and use the standard in the way that's going to help them to achieve what they think is the right thing, but give a standardized, of course, approach to every healthcare organization, no matter how big or small. I think that's absolutely crucial. We've designed this to be applicable to any size healthcare organisation, including the new systems that we've got, particularly in England. But of course, Scotland and Wales have had health boards for quite a while, which is a collection of healthcare organisations, and can be used absolutely anywhere in the world, in any country in the world. We've had a motto throughout the development of this standard: for the world, by the world. And it absolutely has been developed by the world overall.
Now, Adam, you mentioned there that sort of triple threat that healthcare systems are facing, well, the world is facing, really. And people might be listening to this and thinking, well, haven't healthcare providers been operating quality management systems up until now anyway? So I suppose my question is, why now? Why specifically is this the solution to the problems you've set out?
Yeah, no, it's a really good question. It's something we've had to work through as we've developed this standard, because there are quality management systems in existence. And of course, the most important one, and the one that everybody knows around the world, is ISO 9001, and what a brilliant standard that is. However, healthcare is in a very different place. Healthcare, because of the impact of COVID and because of that triple threat and because of the uniqueness and the complexity and the volatility that we have in the health service, that we needed something really specific. We needed to expand upon what the principles of ISO 9001, which is also a management system standard, so that we could really give healthcare something that's going to improve the health and the well-being and the quality of lives of people all around the world. And that's what we set out to achieve, and that's what we did achieve. We've worked very closely with the teams that developed ISO 9001, so that it's not duplicative, it's not adding anything different, but it's adding context, it's adding value to healthcare organizations that's never existed in the past. And we need that standardized approach so that the public has trust that, no matter where you go, if you're in the same country or you are traveling the world, from a globalization perspective, that if somebody's got that stamp of approval of ISO 7101, you have confidence and trust that their quality and their quality management is the best it possibly can be, which is going to give you better healthcare, and you're going to get not only better healthcare, but your outcomes are going to be better. Where that's of course possible, because obviously all healthcare, you can't make people better, but at least you have confidence that that organisation is a quality organisation. And whilst we can argue ISO 9001 does that and can do that, but it's not healthcare related. So any sector can use 9001 and fulfill those amazing principles that are in there. But ours is much more specific to that healthcare sector, and just adds that value to organisations to improve quality and be absolutely on the ball from a quality perspective.
ISO's management system standards are among the most widely used and recognized standards. They include standards such as ISO 9001, ISO 14001, and ISO 50001, which apply to quality management, environmental management, and energy management, respectively. There are in fact more than 80 management system standards, a family of which ISO 7101 is now a part of. One of the fundamental principles of management system standards is that they can work together. And that's because of the harmonized structure. The concept of the harmonized structure is that management system standards are structured in the same way. This means that users who are familiar with one management system standard will immediately feel at ease with another, even when using it for the first time.
Now, I want to come back later to sort of that wider ambition there that you've talked about, and what difference the standard will make. But before I do that, you paid tribute earlier on to some of your fellow standards makers that are sitting around the table and discussing what best practice means for all sorts of things within healthcare management. Can you talk me through who's been involved in the development of this particular standard? Who has been sitting around the table and discussing these issues?
Yeah, so I'm really lucky that we've had a lot of national standards bodies involved. We've had some of our amazing organisations as liaisons into the working group. So we've had the international standards. Sorry, I got that wrong there. It's not the international standards. The International Organisation for Quality, ISQA. In they're a healthcare specific organisation. They've been heavily involved in supporting the development of this standard. The World Health Organization have been connected in and have been aware of us developing this. They can't get involved in standards development themselves, but we've absolutely ensured a connection with the WHO throughout the development of this. Of course, are the safeguards for quality across the world from a healthcare perspective. And we've had over 40 countries actively involved, turning up every 2 weeks to a meeting of our working group, and supporting, in addition to that formal meeting every 2 weeks, subgroups that we set up to develop sections of the standard, bringing in all of their expertise to do this. So we've had people who are clinicians. We've had people who are non-clinicians. I don't like using that word non-clinicians, but people will know what I mean. We've had people who have been involved in healthcare, both from a leadership perspective, a delivery perspective, or a think tank perspective. We've had people who have worked in standards making for many years on different aspects or healthcare related standards that have been involved. And we've had people from every single continent or habitable continent on this planet involved in the development of this standard, which has really been the most important thing for me in developing the working group, that we were as inclusive as possible, that everybody from a low middle income country to a high income country has a stake in the development of the standard. So this standard can be applicable to anybody. We've had people who are running hospitals in India. We've had people who are involved in primary care across Africa. We've had people who are doing amazing work in different healthcare settings in Australia and America and Canada. We've had people from Japan, Indonesia. We've had people from all across Europe involved in this as well. I'm so grateful that these experts and these senior leaders and these people who are delivering patient care on a day-to-day basis have taken 3.5, nearly 4 years of their time to sit with me and sit with the team to really get this standard right. We've been through many, if I counted up the hours, Matthew, we're going into nearly over 1,000 hours worth of volunteering time, probably per individual, to some degree, in developing this standard, with the effort and the commitment everybody's put in. But there's one person that this has absolutely been a leading force in, and I'm really proud to not only call her a friend, but the person who really started all of this off is Angela McCaskill, who was from America, part of the national standards body in America, ANSI, and this project, ISO 7101, led from her master's dissertation about quality. So what we've done through the evidence base is develop something with everybody that wanted to be part of this from every habitable continent and over 40 countries, and from different walks of life, different aspects of healthcare, to develop this standard, which is truly reflective of a modern healthcare society, but is also ambitious for the future. And just as I finish on that one, we had an email recently from ISO about the standards publication and about management system standards harmonization, and they're introducing some new clauses within the harmonized structure from an ISO perspective, and our standard already covered it. And that just speaks volumes to me about how much we've been future-proofing this standard, thinking of the horizon and what's coming, and how now our standard is the first standard in ISO's history to include these brand new points about sustainability, the environment, and driving forward for better lives for people overall. And I'm super proud of everybody that's been involved.
Are you a postgraduate studying at a UK university? Do you have a research idea or project that involves standards in some way? Well, if so, BSI Student Research Program can help. The way it works is simple. BSI gains valuable information about an area of interest to their standards work, while you can benefit from mentorship to support your project and the chance to gain knowledge and exposure that may increase your future employability. To find out more about the program, including case studies of previously supported projects and how to apply, visit bsigroup.com/education. You never know, your project may also end up as the basis for an international standard.
In this second part of my conversation with Adam Layland, Adam describes the features of ISO 7101, the organisations it's designed for, and the benefits to those organisations and others of it being used, and how the standard works alongside regulation. But at the end of the first part, Adam had talked about his pride in being involved in the development of ISO 7101, working alongside many other standards makers globally, and sharing their passion and commitment to creating a great standard. I wanted to know more about that consensus development process for ISO 7101. So I started by asking him about where the challenges had been.
So there's been many. There's been lots and lots of challenges, and over the last 3.5 years, there's probably been a challenge every single week associated with the development of this standard, both from a political perspective, a personal perspective from different individuals, and then just from a standards making perspective. Some of this isn't easy at all, and one thing that really strikes me with standards making is how important language is. And I don't mean language from a translational point of view for different countries, but just getting the language right so that people feel safe and comfortable. And that's one thing that I would absolutely say has been the biggest challenge is getting that language right, getting the nomenclature absolutely spot on so that everybody buys into it. And the hours that I've spent talking to people about just one little word and trying to change a little word has been really, really difficult. But I will say, from the working group perspective, what really worked for us was from the outset, I made my standards really clear for the way we operate as a working group. We developed a commitment to each other, and we used the acronym We Care. Because to me, it was the most important thing that we cared for each other, respected each other, left our organisational identities outside of the development of standards, and really drove forward. And one of the principles that mattered to me to in anticipation of challenges. This is the first big standard I've ever done internationally. But just through my leadership skills and being a professor in leadership, I knew that we were going to hit challenges. And the only way you can overcome challenges is by being really clear up front that we're going to have challenges, but this is how we're going to behave when we have these challenges. And this is what I want everybody to do. And of course, everybody committed to that. And one of the biggest things was not going back to unpick things that we'd already agreed. I've seen this time and time again with loads of projects that I've been involved in. And so that experience that I've had led me to make this point really clear at the start of our working group when we all came together. And every single meeting over the 40, 50 specific formal meetings that we had always started with a reminder of this commitment, that the We Care commitment that we set out. And don't get me wrong, people did try at times to unpick things that had been agreed or voted on in our working group by consensus, or things that we'd asked the technical committee to vote on, and people did try and unpick it. But I was absolutely resolute as the convener of that working group that we're not doing that. I'm not allowing that to happen unless there is a regulatory or legal reason why we need to unpick it. And it did lead to many votes. We did have to, vote as a working group, and I use the word vote. It's not ISO specific that working groups vote on things, but I wanted us to make sure we really had that consensus in the working group. So I did put some votes in just live on the meetings, so that we could build that consensus and go the way that everybody wanted to go. And we went through the full process. We had over nearly 1,000 comments back throughout the process. Some of them really tricky, some of them really challenging, and really questioning why you need this standard. And I think that's the biggest message with standard making is it is very trying. It tests your own values quite a lot. It tests your own resilience. And my advice would be work through it. You've got some great people around you when these things happen. Work through it, and you will get to the result. And you'll be feeling like I am now, super proud and elated. And really excited to see how this standard can have a major impact for people in the world.
Well, like you say, Adam, the standard is now published after all of that hard work from yourself and those thousands of people around the world. So take us inside ISO 7101. What are the key features of the standard?
So this standard is absolutely about the attributes and the principles to improving a management approach to quality in healthcare organisations. And what we've done within this standard is really identify and use that evidence base to promote effectiveness, safety, accessibility, efficiency, and equity. They're the absolute key things that comes through on this standard. But we've broken that down into areas. So the areas that are in this standard talk about leadership and the importance of how leadership really drives different cultures, behaviors, and outcomes overall. And of course, there's a huge link from a leadership perspective into policy. And that's either pushing upwards into governments or policymakers in different parts of the world through local governments or national governments, and using leadership then to inspire people and to get a different message out about the culture and the behaviours that you want to see within an organisation that is accredited to be a quality organisation. The other aspects that we've got within the standards are absolutely about planning. How do you plan to have quality? How do you plan to run an organisation? And there's an old saying of if you fail to plan, you plan to fail. And so it was really important that we got a whole aspect of planning within this standard, so people understood how do you plan for quality. You can't. It's not just a flick a switch and there you go. You've got quality. Some of this will take years. It will take massive changes within organisations to implement. So how do you actually plan for that, and how do you do risk management effectively? And this is where ISO 7101 links into other standards that are present at the international level, because we can't address every single concern. We can't say we can't within ISO 701 we can't give you a standard for risk management. What we can do is point you to the standard for risk management. But what we can say is you need to have a risk management process within your organisation to meet this standard for management quality in healthcare. So planning is really important. That risk management is really important. One thing that our wonderful experts from around the world also were really passionate about including in the standard was how do we communicate with people? Healthcare is all about communication, whether that's from a one-to-one basis with a clinician to a patient, or how you're supporting the quality of healthcare through communication, both internally within an organisation, but also externally with the populations that you're there to serve. So we've got a huge section of setting out those principles associated with communication. And as everybody who's ever been in a healthcare setting knows, there's a lot of documentation that goes with it. There's everything that you say is written down, everything that's done for you is written down. So the documentation of healthcare is a huge quality aspect, because that documentation not only is the record of what happened, but that's how we understand how quality is impacting on people. That's how we audit things. That's how we check that changes are being made and it's effective when it is made, because we can track all of that through and see the data and see the evidence of those interactions from an individual perspective. We can identify those trends and themes, which leads us to build better healthcare organisation overall. As you'd expect, there's also a huge operational aspect. So we've got facilities, waste, storage, all of these things. Again, I've got other standards associated with signposts to different bits. And the bit I'll just finish on, because I could keep talking forever about what's included in this standard, but there's a huge aspect about people. How are we really inclusive, bring diversity of thought and co-produce our future healthcare organisations? And that has a huge quality implication. If we don't get that right, you're never going to get quality overall. So there's aspects about how do you involve patients and the public, what's the education and training needed for everybody, how are we evaluating what we're doing, and we operate the PDSA, the Plan, Do, Study, Act cycle, as a quality improvement mechanism within the standard, because quality in healthcare isn't a one-off tick box exercise. Just complying with this standard at the moment in time that you're accredited is great, because you can demonstrate that you have achieved everything associated within the standard to get accredited. But that is just the first part of the journey. You've got to continuously apply it, continuously improve, and demonstrate how you're improving when that accreditation comes around the second time.
Do you want to help make people's lives easier, safer, and more enjoyable? Well, why not become a standards maker and have your say on the development of standards? Standards affect all of us every day, wherever we go, whatever we do. By defining good practice, they help people, organizations, the economy, and society to do things better. Each year, standards bodies publish thousands of standards, and we are looking for more people like you to join our community of standards makers. We welcome applicants from all fields, backgrounds, and career stages. Our goal is to have a balance of views around the table. By becoming a standards maker, you could help to create cities that boost people's well-being, make strides in AI governance, build healthier and more inclusive workplaces, and even develop higher quality healthcare systems. So, if you want to make a difference and shape the world through standards, start your standards making journey now. Simply visit bsigroup.com/get involved.
Now, Adam, you mentioned that this standard is applicable for all sorts of healthcare providers all over the world. It has to be relevant for, I think you mentioned, hospitals in India, or it might be in the States, or here in the UK. I want to ask you to get really specific here and think about one of those institutions. So, I might be a senior leader in a hospital in the south of England. I'm aware of this standard, thinking about how we might improve quality, looking to adopt it, and we start using it. Maybe after 2, 3, 4 years, what are the benefits of my hospital of using this standard?
A standard will give you the processes naturally, and it will give you all of the aspects that you're going to, if you achieve this, you could have a much more improved healthcare organization overall. There's of course evidence from other standards and how standards have improved lives and have saved lives and have developed economic viability for areas. So we know standards can do this overall. But from this specific ISO 7101 perspective, we know just through what other standards have done that the outcomes can have a significant impact not only on individuals but the economic environment of a locality or a country in that sense. Because if access and outcomes from healthcare is poor already, then there's going to be a reduced working population contributing economically. It's in everyone's interest to make healthcare and the outcomes of healthcare much better than what they can be. So, what this really does is it will start to improve experience and satisfaction of people receiving healthcare. And that doesn't not necessarily need to be a patient or a service user. That could be their carers, their relatives, their wider family as well, because we know healthcare impacts on not just that one individual, but a lot of people at the same time. And as I said earlier, the importance of being accredited with a standard demonstrates to your patients and your public that you're wanting to do the very best that you can from an international recognized standard that, as I say, 40 countries, every continent of the world has helped to develop. You know that they are interested in quality. They've got a passion for quality. They want to improve. So your reputation can improve because of that. You become an organization that's more attractive to people because if you had two choices of hospital to go to, and a lot of people have a lot of choice, not everywhere, but there are choices where you can go to, and you looked at two similar institutions, and one of them had accreditation with ISO 7101 and one didn't, and you did a bit of research and you googled what it meant. When you realize what ISO 7101 does, that's the hospital you want to go to. So it has a massive reputational impact, as well as those outcomes of improving patient experience and satisfaction and healthcare outcomes for patients. But similarly, it's really attractive as a member of staff. If okay, they're really interested in quality as an organisation. They've got accreditation. I would want to go and work for them because everybody wants to be part of something that's doing well and delivering well and is driving improvements and has got that mindset associated with it of quality and improvement. So recruitment could improve, retention could improve, because people are going to want to stay with you, see you on this journey doing something really differently. And we know that organisations that do this um, are more likely to be performing against what they need to perform against. Those metrics that they're given from organisation, from governments and what have you. If you've got your workforce there and you've got a motivated workforce and you're driving a different culture of quality and improvement, then you're going to improve on your outcomes, your KPIs, your performance metrics overall. And what that can then lead to is more devolution from your commissioners or the people that are funding you, because if you're achieving, they're going to give you more leeway to do more, better, and greater things. And that opens up new funding opportunities and exciting ways for organisations to develop and to become bigger, better, and more impactful overall, because they've got this standard operating that's helping the leadership, helping the running of an organisation. And then that can lead to new medicines and new research and new outputs for dealing with these growing population demands and the multimorbidities that we're going to see in a really different way, which can lead to better health outcomes as well, and a change in how health organisations operate within their area. So for me, this is, the benefits are massive, and it just keeps rolling on and rolling on. And I'm so excited to see it now come to fruition, and to see, and hear about all of these benefits that are going to come out. And I'd love to be able to, in 5 years' time, is have a look at the impact that it's had and what it's actually done, because I think there's going to be other things in this that none of us can see right now. But I'm really excited to see it all come together.
Adam, healthcare obviously is a hugely regulated part of our lives, really. A huge amount of public money is spent, public and private money is spent on healthcare provision. I just wonder, how does the standard fit with sort of all these regulatory requirements for healthcare globally?
Yeah, so there's different factions of thoughts on regulation overall, and some people think that, if a regulator comes and they see things and it's bad, and give you a rating of inadequate or requires improvement, as we've got in England with the Care Quality Commission, then actually it's a bit too late by the time they get there, because it's been bad for a while. It's not just bad on that day. And if they come, and the other train of thought as well is, if they come and you're good or you're outstanding, as we rate in England, then actually what's the point in them coming in the first place, because you're doing all right. So regulation's got a huge difference of opinion globally associated with that. However, from my perspective, where ISO 7101 really helps from a regulation perspective, it gives you that stamp of approval, for want of a better phrase, before the regulators come. And if you're complying with this and you've been accredited to this standard and you're operating the standard in the way that it needs to be doing, then you can demonstrate to regulators that we're all over quality. We're a quality organisation. Not only do we say we are, but this accreditation body says we are, because we're compliant with ISO 7101. And that matters to us because we're on this journey to improve continuously. And so I think that helps from a regulatory perspective. I think it gives a lot of confidence to regulators. I think it will help regulators to determine where do they need to spend their precious resources and attention. So, hypothetically, if I'm an organisation that's accredited with ISO 7101 and I'm doing well and I'm performing and achieving all of those benefits that I was just talking about, the regulator might not come to me for quite a while. They might be really content that the triangulation of their evidence, the assurance that they're getting from that confidence and that evidence base, means they don't need to come and regulate me right now. They'll still come at some point, because absolutely that's the right thing to do, but they can go and concentrate on areas that perhaps haven't got the same quality and perhaps are really struggling, need that support and need that guidance from a regulator. So I think there are huge benefits again to adopting ISO 7101 and utilizing this as part of your regulatory compliance. There are other standards out there that can help with regulatory compliance as well. And you're thinking about data and security. That again all adds this confidence and this evidence base to how you are as an organization and how you want to do the best thing possible. But yeah, I think I really do believe that regulators will be massively on board and supportive with this standard as well.
Now, Adam, I'm going to put you on the spot now. You talked earlier there about impact. So overall, in your view, what difference will this standard make, and how will we know when it's made it?
So for me, I will know that this standard's made an impact if we benchmark where organisations are right now on their delivery and where they'll be a couple of years after they've implemented ISO 7101. I expect a significant increase in output. I expect a significant increase in experience of patients. And for those that are there from a commercial perspective, an increase in their income as well. That's a bold statement to make, I know, but I really truly believe that this is going to have such an impact on the delivery of healthcare services around the world for people that use to adopt this standard, that it will do all of those things. This is for me that what's driven me throughout this standard and the development of this standard is that this will make an impact to every single person on this planet. There's no shadow of a doubt that where this is used, that impact's absolutely going to be there. And of course, I'd love to see every healthcare organisation in the world using this standard and being part of this standard. Even if you don't get accredited, that doesn't matter ultimately to me. It matters to national standards bodies, of course, and accreditors. But what matters to me is that you adopt the principles and you adopt what our international experts have set out to say this is what makes a quality healthcare organisation. Because we all come to work in healthcare to do the best thing we can for our patients and our populations on a daily basis. And so using this, the implication on that will not only be highly satisfying and rewarding for individuals, but you'll be demonstrating the improvement that you've had. And how wonderful does that look? Everybody wants to be part of something that's great and doing well. And if you just look at where you're at now, look at where you're at when you've implemented the standard, you will see such significant improvements to the outcomes of healthcare, the populations that we serve, and having people working for us longer, more attractive for people to come and work for us. And we can start to deal with some of these triple threats that I mentioned at the very beginning, because you'll have more income, you'll have more workforce. You're never gonna stop people coming to the hospital, but they'll want to come for the right reasons, and you'll be able to give them the best that you possibly can because you've adopted the principles of this standard.
My thanks to Adam Layland for sharing his insights and experiences about the standard ISO 7101, Healthcare Organisation Management. And not only that, for his passion for quality in healthcare and for that desire for the standard to make a real difference to patient experience, not just here in the UK, but right around the world. And I'll be honest, there's a bit of pride here in yours truly too, in having played a small part in Adam's standards journey, in me being right there at the beginning. Now, if you want to know more about the standard ISO 7101, how to get support for research about standards and how to get involved in standards, then check out the links in the show notes.
You have been listening to an episode of The Standard Show with Matthew Childs and Cindy Paragill. Subscribe to The Standard Show now, wherever you get your podcasts.
You just heard a Stripped Media production.